3.
Teleprompter up.
Action.
Hello, and thank you for joining us today. I'm your host, Joy Brown, and you're watching WebMD's Ask the Dentist. Joining me here today is Dr. Stephen Roth, a member of the American Dental Association and the American Academy of Cosmetic Dentistry. Let's get started. My sister is diabetic, and her dentist told her she's at greater risk for gum disease or gingivitis. What should she be doing?
Well, that's a great question. And diabetes is a disease that affects many systems. A diabetic is much more likely to have gingivitis and inflamed gums. The response of their immune system to fight these infections off is not the same as someone without diabetes. To me, it's much more important for a diabetic to come in more than twice a year to have their teeth cleaned. Several times a year will do it better, maybe every 2 months or 3 months. It's very important that a diabetic does not get infections, and gum infections can blow up, as you know.
Never would have known. So that's something, and obviously that's one of the reasons we fill out the healthcare questionnaires when we come in your office. That's the first thing you look for, is something like that?
Yeah, any dentist will always look over your regular health history first, because there are many conditions that can affect your dental care.
I'm on low-dose hormone replacement therapy, and I think it's making my mouth dry. What can I do?
Dry mouth is dangerous for several reasons. One reason is the less saliva, the less protection you have against tooth decay. You also can get bad breath from it, which is not a health hazard, but it may be a health hazard to the people around you. Xerostomia is the name for dry mouth, and there are several things that can be done, as simple as drinking more water, perhaps using some chewing gums or candies to stimulate saliva flow. There are actually saliva replacement therapies for people who've had chemotherapy and other treatments that can actually knock out the salivary flow.
So saliva has a crucial function.
Saliva has its own immune system, and it protects your mouth from infection.
Makes sense. Acid reflux caused my first cavity at 35. What can I do to prevent any more?
We can see by certain patterns on the teeth where the acid is dissolving the enamel. Sometimes it's a lot, sometimes it's a little. But the real danger is what's going to happen with the acid reflux disease. That can cause some very serious health problems, such as cancer of the esophagus. The number one thing I do when I see the sign is I refer them back to their internist or to their gastroenterologist for a workup, because this could be a fatal problem. It also is uncomfortable. It can cause chest pains and it can cause difficulty breathing. Never mind the damage to the teeth.
So you think someone can actually discover their acid reflux condition by seeing their dentist?
Absolutely. Absolutely.
Because you can see a lot of the signs.
We could see damage to the teeth caused by acid. We then have to figure out, is the acid coming up or is it coming into the mouth, such as sodas and acidic drinks?
I see. But the acid from the body, it causes a lot of damage.
Absolutely.
Yeah. I have sleep apnea and use a CPAP machine. Over the last couple of months, I've been having problems with my tongue and gums drying out. I've tried all kinds of products, but nothing helps. What can I do for dry mouth?
Well, the first thing I would look at is the dry mouth just being caused by the CPAP machine? Because if it is, then the dryness will be in the middle of the night and upon waking up, when it's hard to take products to make your mouth not dry. However, you have to look at the fact that the CPAP machine may be keeping you alive. Okay, we need to breathe while we're sleeping, and you have to take priorities. Yeah. Obviously, if it's a problem that's going on all day, it may not be related to the snoring or the CPAP machine. It may be related to medications or other medical conditions, and that needs to be evaluated.
Yeah, first things first.
Absolutely.
Yeah. Are dental implants safe for people with autoimmune disease?
There are many autoimmune diseases, and it's safe for most people with autoimmune diseases. It depends on what type. The patient needs to be worked up, and bone studies need to be done, and several things need to be done so the surgeon knows whether that patient is a candidate.
So what's the first step?
The first step is to have a firm diagnosis from a physician with a clear medical record about medications and what the dangers are. A dentist will call the patient's internist or whoever's in charge of their care for their autoimmune disease and discuss what the options are in advance.
You enroll the physician in the process and make sure it's...
Communication is what it's all about. And if most of the time dental implants are an elective procedure. you're doing it to improve the level of your oral health care. However, if you're on immune suppressing drugs, your priorities are different.
Again, you've got to look out for what's more important within your individual body. How do you find a dentist who treats people who are in wheelchairs or with limited mobility?
I think that there are several laws in place right now to make sure that all dental offices are wheelchair accessible and can take care of people with mobility problems. However, based on where they're located, you may find a different answer. And I always recommend patients call their local dental society. You can look it up on the internet or you can call information. They usually have great information about how to get the best access to care.
I never would have thought they would have been approachable for a member of the general public to call them and say, help me find a dentist.
The dental societies are there for the consumer as well as for the dentists to help them. And they have a wealth of information.
Oh, that's really good to know. My son has autism. How do I find a dentist who cares for kids with special needs?
There are several organizations that you can be referred to by your local dental society, such as the American Academy of Pediatric Dentistry, the American Academy of Handicap Dentistry, and they can supply a referral and someone who could really help you out.
Again, good organizations to know you can call.
Great organizations.
Here's another one from a WebMD user. I've been on methadone for pain management for 7 years. Could methadone be causing this horrible decay of my teeth? I used to blame it on the vomiting, but that has been so long ago now, and my teeth continue to get worse and worse. Sometimes even teeth that appear okay will just break apart in my mouth. That sounds so painful.
Yeah, that does sound painful. And methadone will dry out the mouth. And as we spoke about, the saliva has your immune system, and it has your abilities to fight off decay and infection. The methadone almost completely knocks that out. If the patient is taking the methadone because they had a prior drug problem, it could be that the drug problem caused a lot of the tooth decay for the same reasons. Not taking care of yourself, immune system problems, and a craving for sugar are all related to tooth decay, and people on methadone and other drugs such as methadone crave sugar. So there's a few different problems with that question. And the best answer is to go to a dentist, have the problem diagnosed and dealt with. There could be fluoride therapies and other methods that can help this patient.
Okay, this next one from a WebMD user. What can you do to prevent oral cancer?
Oral cancer doesn't have a medication or a vitamin that can help prevent it. However, you can look at the risk factors and figure out how to best avoid it. There is a genetic component. So obviously, if there's a family history, you need to really have oral cancer screening checked all the time. And most dentists will do that at a regular hygiene visit. You can also not smoke, not chew tobacco, control how much alcohol you drink, because those are the highest risk factors of oral cancer. And oral cancer is mostly a fatal disease.
So, wow, is it?
Yes.
High percentage?
Very high percentage.
Wow. But all those risk factors we've heard a lot about in other areas. So.
Absolutely. And when you look at all the information we see about other cancers, such as breast cancer, early detection is the key. Oral cancers that are found early are most likely to be corrected and not have a problem.
When you say found early, is there any sign that I would see? I mean, is this going to, like, sometimes we all get little things in our mouth that bother us and they go away after a few days or something.
That's the key. Do they go away after a few days?
Okay.
Red spots, white spots, things that look unusual that last longer than 10 days to 2 weeks should absolutely be looked at, because those are signs of oral cancer.
Very important to catch it early, obviously. Okay, here's one from a concerned WebMD user. My dentist says I have diabetes or pre-diabetes and should see my doctor. How does he know?
If the dentist sees some abnormal inflammation of the gums, or perhaps smells a fruity odor on the patient's breath, those are signs of undiagnosed diabetes. If a patient's coming in on a regular basis, seems to take good care of their mouth, yet still has the inflammation, that's a warning sign to a dentist that maybe there's something going on here, and they'll refer that patient to a doctor for a simple blood test. And the blood test can give you tons of information.
So it's just kind of one physician helping another?
Absolutely.
Yeah.
You know, there are more people that go to a dentist for a regular checkup than go to a doctor for a regular checkup. So many times we find that we have to refer people and get them to started on the process of seeing a doctor.
Yeah, a lot of us, we either have fears of one or the other, and it's hard to choose. But it's nice to know that you can tell so much about general health conditions. I didn't realize that.
Yeah.
I mean, I thought I was seeing you just for my teeth, but you find out a lot by going in there.
Yes, you do.
Yeah. I have a fear of dentists. How can I find a dentist who really does work with that?
Once again, if you call the local dental society, they can refer you to somebody who's a dental phobia specialist. There are certain dentists that limit their practice to phobic patients. There are also other therapists like psychiatrists and psychologists who can help you with the process, who will then refer you to a dentist because they work with certain dentists that specialize in that particular subject. There are things that can be done at your general dentist's office to help you, such as sedation, sleep dentistry, and maybe it's as simple as having nitrous oxide or laughing gas to help you get through the appointment.
Wow, I wouldn't have known there was a dental phobia specialist, though. I wouldn't have realized that some dentists specialize in it.
One thing that's wonderful about dentistry is that almost every dentist continues to go to continuing education after they graduate from dental school. And there are different directions you can go, and there's some people that like doing dental phobia, and they want to help people who have those phobias.
That's really nice to know. Yeah,
Yes.
that there's some that want to really help you
I'm
get.
sure there are some dentists that were dental phobics themselves.
I cannot afford dental care. I simply do not have the money. In 2008, I had 3 crowns simply fall off because the teeth had become seriously decayed and crumbled. Once I bit into an apple and had a tooth fall out completely with no signs of roots on it. The decline of my oral health has been frightening, and I have no way to get help. I'm so scared. What can I do?
This sounds like a patient who has a lot of problems, and these are challenging economic times for a lot of people. And the best suggestion I could give is there are dental schools, there are hospital-based dental programs, and there are clinics all over America that are there to help people who can't afford to have regular dentistry done. You can call the dental society, you can do an internet search, you can look in the yellow pages and find some place that will take Medicaid, public assistance to help these patients out.
Oh, it's good to know there's help out there. If I'm on medications for chronic pain, do I need to tell my dentist before she uses any anesthesia on me?
I think that telling the dentist about your chronic pain and what medications you're taking is a critical part of a health history. The dentist doesn't want to give a patient medication or anesthetic that could actually cause them a problem with their chronic pain medication. They also need to know that because people that have chronic pain don't respond to anesthesia the same way as somebody who doesn't have chronic pain. They may need more. They may need to have other types of anesthetics given to them.
Just like any other drug interaction, you want to be sure you know everything going on, I guess.
It's all about the information.
Yeah.
We can serve the patient best with the most amount of information.
Yeah, so tell your dentist everything, right?
Tell your dentist everything just like your doctor.
Yeah. I have all sorts of allergies. What do I need to discuss with my dentist before treatment?
There are certain conditions in dentistry that can mask a problem with the sinuses or allergies. There are certain ear, nose, and throat problems that are really a dental problem. And once again, there should be communication between the ear, nose, and throat specialist and the dentist. There are patients who have tooth pain that have nothing wrong with their tooth. They have a sinus infection. It would be a shame to see them go through a root canal or an extraction. So it's very important to take a full history, to report all the facts that you know about yourself, and for there to be communication between the two specialists.
Well, again, communication is everything. Very important for both your physician and your dentist to know everything going on.
Yeah, and look at the proximity between the mouth and the nose and the ears. They're very, very close. There's ear, nose, throat, dentistry.
Very interconnected.
Yes.
All makes sense. How will I know if the medications I am taking could affect my dental health?
There's a wealth of information out there. You can even look on WebMD to find that information. But tell the dentist to all the medications that you're taking. In our health history forms, we have a very wide open slot to write all your medications. You can list them. You can bring the list with you. it's very important for us to know what's affecting the health of your mouth, your saliva, your immune system. Very important.
Again, good common sense when it comes to what you're doing with your overall health and communicating it to your dentist.
One of the best things that I see is with some elderly patients, because they know they may not remember everything they're taking, they have printed lists that they carry with them at all times, and they just hand it over. And that's very helpful.
Very smart. I'm a recovering bulimic, and I have enamel damage from all the purging. Is this permanent?
It is permanent. The acid completely removes the enamel from the surfaces of the teeth, and it's a heartbreak. The good news is there's some new restorative technologies that enable us to restore the teeth so they look great, feel great, and last a long time. And I think it's really important for a bulimic who's recovering, if they want to see a real nice increase in their self-esteem, if they see what their teeth used to look like back in their mouth, that really helps them. And the nice thing also is if the restoration of porcelain goes just below the gum line, it gets the mouth into a condition where the acid is not affecting those teeth. And that's really important.
That's very hopeful information there. So if you damage your teeth that badly, is there some way you know?
It's very hard to not see the damage, but a dentist will see it better than anyone because he's able to look behind the teeth and on tops of the surfaces of the teeth.
Yeah.
And that's really the way to know.
Looking a lot more closely.
Yes. It can become a sensitive subject sometime when
Sure.
a patient doesn't tell you they're bulimic, but you see the signs of it.
How do you broach that subject with someone?
Carefully.
Yeah, I'm sure.
And with sensitivity.
Sure. Well, Dr. Roth, I think that's going to do it for this episode of WebMD's Ask the Dentist.